This is Hold My Stethoscope.
Hey everyone, welcome back to Hold My Stethoscope. I'm Brittney.
And I'm Felicia. And tonight we have a stacked lineup. Honestly, I don't even know how we can convince all these people to hang out with us.
It's food. It's always food. We get bribed with food.
That's a fact. Nurses will show up for some snacks. Now, that's the truth.
So let's get into it. We've got Dom here. You may remember him from a couple episodes ago, our unofficial king of story time.
Thank you.
Hey, Dom.
Glad to be back.
I'm glad to have you back. And then we have Anthony. Anthony is one of our ex-ICU educators, now CRNA student. Congratulations, Anthony. We're very proud of
Thank you. Thanks for having me.
Most definitely. He's a guy that makes us all feel like we should have studied harder, and that's the truth. For
Nope,
real.
that's
He's
not the
got
truth.
old man soul. He's got that old man soul, but he's a lot of
Basically,
fun.
he's the smart one.
Very smart. Yeah, he's the
I'm the smart one in the
group.
group. That's not good.
Logical. He's the logical one out the group.
Yes, he's the one who's
All the
always
brains.
kept us in line. So
Yeah.
let's dive in. Tonight's topic is airway disasters and saves. If you've been in critical care, you know that when an airway goes south, it goes south fast.
And that's the moment where everyone suddenly gets real religious in the room.
Yeah, and you never want to run away to try and go and grab something. You should always have it ready to go.
So Dom, start us off. What's one airway moment you'll never forget?
I think one that was actually kind of familiar reminded me of a movie called Big Fat Liar. I don't know if any of us have watched it. The man turns blue at some point in the movie, but in one point in the movie, he's like, "You're more likely to choke on a chicken bone than a meatball." Well, unfortunately, the patient that I had was choking on a meatball, but no one knew it. So when we go to intubate this patient, we didn't have the gyroscope available, so we're not able to visually look into the airway. We did not get the background story that this patient was eating prior. So as we go to intubate, we go right through that meatball. We start bagging the patient. We're having difficulty. We really can't get any air movement. The CO2 detector is not really turning. We take it out. A big chunk of the meatball. We went right through it. Thankfully, it was still on the end of the tube when we took it out, but that goes to the importance of making sure you get that background. Well, anytime you're dealing with emergency patients, you get that SLR so you know exactly what you're dealing with. You don't always have the greatest, most up-to-date equipment available, so you always go with your backups. And unfortunately, if we had that background, we could have avoided going possibly through the meatball and taking a good look and seeing what's going in there. Patient was obviously confused at the time, and the best part of it is that the nursing home was feeding her, and so they could have let us know that.
So I
How
have
about
a
you guys?
question about this meatball though for a second here. So
Mhm.
did you push the meatball further down? Like did you go all the way through the meatball?
We definitely pushed that sucker down deep, and then we ended up coming back with it. But we were able to visualize it after because we ended up going in with some forceps, and we got the gyroscope available at that point. Because trust me, we're gonna find it now. And then as you look, we were able to go in and scoop the rest of the little bit of the meatball out. You get two sections of it, thankful. One, the other half, and you can see the donut hole right in the middle,
Nice.
Wow.
Ooh, what kind of meatball was
Nice.
it?
Okay, good story, Dom. I
like
like
a lamb meatball.
Wow.
I'm like, and here we go. While you were feeding patients whole meatballs, like
Whole
please tell me why
meatballs.
we're
They
feeding
didn't
the
even cut
patient a
it up.
whole meatball. No, no. I'm
Cool.
like,
She didn't chew either.
No, she didn't
come
chew,
on,
Anthony.
come on. I can't.
Okay. Well, Anthony, you've seen it from the ICU side and now in CRNA school. What's one airway that taught you a lesson you'll never forget?
Ooh, I mean, in the ICU, luckily, we have a little bit more resources than the ER. So we're usually a little bit more prepared there. I mean, COVID, there was always bad things going on, but that was mostly just the disease process. But from like a CRNA standpoint, it's definitely more interesting because we are the airway, managers at that point.
Absolutely.
And actually last week I had a patient. She was, a little bit on the heavier side, and we took out her ET tube and her airway just like immediately collapsed. That tongue dropped. She bronchospasmed, and we just like
Wow.
it was so hard to bag her and try to bring her back. There's like a whole bunch of us, squeezing the mask, squeezing the bag, trying to get her
Mhm.
to breathe and come back. And I tried to put a nasal trumpet in this poor woman, and like I barely touched just the tip of her nose, and blood just came spraying out of her nose. And I felt so bad. I mean, it was nothing that there
No.
was nothing we could have done to prevent it. It just was the nature of it. But it's just crazy how fast you can go from, having an airway to suddenly your patient's not breathing and you're trying to do anything you can to bring them back.
So did we lose her, Anthony?
No, no, no. She's fine.
Well, very good.
Of course we
So
didn't lose her.
Ooh, honey.
I'm over here saving lives. He's over there ending them. Like, please.
Well, sometimes these things occurred. I mean, that was scary. Spasm, now blood coming all out her nose. I bet everybody was like freezing up. You
Yeah.
can't even really bag her. It's like, okay, what are we doing? So what'd you do?
I mean, it was really just like anesthesia is so different, from
Mhm.
bedside nursing because we took away her like
Ability
respiratory
to
drive.
right.
So, and then trying to get them to breathe again, you just don't always know exactly what's going to happen once you take out that airway. So, we did everything right. We did everything by the book. We just had to try to get the tongue off the back and then get
Right.
some positive pressure in there. But it was a challenge.
Oh my God, that's scary. Ooh. But that's
Yeah.
interesting. Okay.
I mean, yeah, it was good to see.
It is.
Unfortunate for
Somebody
the
went to
patient,
school.
but I mean, she did really well afterwards. Like once she was fully awake, she had no idea.
Okay.
She had no idea of anything that happened. Like her nose had even stopped bleeding. Like she was completely clueless. I did tell her, but she was like, okay.
She didn't have any body aches or anything? Good. Okay.
She was fine.
Great
Just
story.
scary,
That's
terrifying.
scary.
I'm sure that adrenaline is pumping.
Oh, yeah.
Well,
Yeah, my
especially makes it more difficult too when you have, a patient of different body habitus, which leads to, I guess, kind of my most difficult airway. So I am also over kind of the pediatric ED, and I will tell you that some of the scariest situations I've been in before is when a pediatric patient comes in and they can't get an airway on that patient. You have to just kind of imagine, I mean, kids in general, right? They've got these really small airways. And usually with kids, when they come in, they're sick. And it's usually a respiratory thing. So having to try to intubate like a straw is so difficult. You have to have a very experienced provider, and that's always been difficult, like, when we've had, intubations that have been difficult because 'cause you're just sitting there, like, kinda helpless until you can get somebody, anesthesia or whoever to come in and be able to try to bag it because that's really, like, a really hard part is to be able to sit there and watch a kid not be able to breathe, and you're not being able to really do anything other than try to support the oxygenation, so
Right.
Anthony, have
Absolutely.
you had to do that at all in CRNA school yet? Like, do the pediatric side?
Yeah, it's pretty crazy. Tiny little tubes, the tiny little airways. I mean, it's really a finesse. And then, I mean, I'm not in the ER, so I'm not dealing with these kids in like immediate crisis. It's a little bit more controlled. So we get the resources together to like do it right. But I couldn't imagine having to be in the ER and try to stick, a Capri Sun straw into a 2-year-old's vocal cords. Like, that's crazy.
What
Yeah.
about these people that are more anterior?
I mean, those are still a challenge. Kids are usually more anterior. I mean, now with like the technology of like the Glide and the McGrath, you have more
Yes.
video options. It makes things a little bit easier,
Okay.
but still, those you never know when someone's going to be very anterior. And then you stick your blade in there and you're like, oh, there's nothing there.
There's nothing there.
And then
Exactly.
you're like, oh, now what? You kind of got to make it up. But again, my environment's much more controlled. Like the OR is very methodical.
It is.
The ER and the ICU is a much different beast because you're not planning on having those things go down. You're scrambling.
Are you guys
Brittany,
using the gyroscope or are you doing it the old school way?
It's a little bit of both. Like from the anesthesia standpoint, you usually kind of screen your patient ahead of
Mhm.
time, right? Because we get to see them in pre-op. It's one of the
Okay.
benefits of not being in the ER or the
Okay.
ICU. I get to go ask them all these questions, right?
Mhm.
So I'm like, oh, do you snore? Are you tired during the day? Like, have you ever had issues before? I get to, get an idea. So then when we do bring them to the OR, I already know, okay, yeah, they're probably going to be, I can probably just use a straight blade and they'll be fine. Or,
Okay.
I'm like, oh, this patient's high risk. So I'm going to just jump to the video scope. So you kind of triage based off of your pre-op assessment.
Got it.
But I would say video scopes are becoming the new like standard of care because they're safer.
Yes, they are safer because you can see it. You can see down there.
You use LMAs a lot?
Say that again. I'm sorry.
You use LMAs, the laryngeal
Yeah.
ones?
Mm-hmm. And those are really big in like short cases, or if you have someone who's got like a very reactive airway, and the last thing you want to do is stick an ET tube in there. So
Absolutely. Absolutely.
it kind of depends. If you're coming to have your toe amputated and it's only going to be a 30-minute procedure, then yeah, we'll stick an LMA in and then
They also
go
used
from
them for
there.
breast augmentations because they were 30 minutes.
Yep. A lot of procedures nowadays are pretty quick. You can get away without not having to intubate.
Nice.
That's good. That's awesome.
What
That's
about
Yeah.
exciting.
Felicia? What's been a crazy airway story from your standpoint?
Crazy
Don't be in
airway
the dark.
story from my standpoint probably would be my husband's closest friend actually was having chest pain, and he has a significant history and should never have gone to one of the standing alone ERs. I'm sorry, he just shouldn't. He should have gone to one with more of the stuff there. And he actually got there and was pretty much like, "I'm just gonna have them take this water off my chest." That's just kinda how he used it, and told my husband, "I'll call you when I leave here on my way home." He never made it home, and we're not sure 100%, but we do believe that something that was given to him probably put him in anaphylaxis, which blocked his airway and everything, and then they just were unable to intubate him. In a freestanding ER, they don't have all the equipment in the rooms like we do. We might run and grab a crash cart, but then we should have an ambu bag and all that stuff in there. Their stuff is not set up that way. So now they're running trying to get everything while this person's airway is blocked, and he didn't make it. It was pretty
So
sad.
sad, yeah.
I'm
Well, I
sorry, it
think
was a sad story,
I
still
know, I was
sad.
like, you gotta prepare
It's
us for
really
sad story.
sad. Yeah, and so he never got a chance to call Anthony on his way home, which made it even sadder, you know?
Well, I
It
think
was
you bring up
sad.
a good point, right? Kind of going with this educational topic is there are other things, right? Other modalities that can be used when a patient's airway is crashing. Like Anthony talked about the nasal trumpet or the nasal pharyngeal airway, the oral pharyngeal airways, the LMAs. We can do things like in an ER situation or even an ICU situation if needed, going into like crikes and all of those
Right, yep,
things. But, trying to at least main open up and get a patent airway is gonna be the biggest priority, I should say, and then being able to ventilate them comes second, but you need to get that airway established or you're never gonna be able to get, the ventilation and the oxygenation to the patient. So, securing your airway is super important. And then, kinda like Anthony talked about, position of comfort's also a pretty big thing, you know, with potentially his lady over there, having to like look about things, like different Trendelenburg styles because maybe laying flat's not the appropriate style. We talk about with kids putting them in stiffing positions because how big their heads are, we have to be able to kind of put them back a little bit further because we don't want to kink their airways off. So just different things to think about as you look at your patient and their airway issues or potential issues.
just listening to this. Y
I know now I'm nervous to go back to the hospital and go back to clinical. Oh my
But
gosh.
honestly, y'all, plan B really is we just need to be yelling for respiratory, let's keep it real. That is why they are there.
Respiratory.
Respiratory, that's job security right there. Listen, get the people that specialize in the airway at the bedside. That's my take on it. I'm just saying.
Yeah, I mean,
Can't do
sometimes
that if
that's what works, or, like, that's what you need to do.
Right.
Brittany, I have a question for you regarding pediatrics.
Yes.
What is your stance on parents at home having the suckers for when the pediatric patients are choking?
I have honestly not seen anything bad about them. Like, I've only seen and heard good reviews. So I feel like if that is something that you're comfortable doing and using, then go for it. Because, especially the young, toddlers, they are especially starting to explore. They put anything and everything in every orifice that they can. So there is a good chance that they are going to be choking on something. And if that thing, and like I said, I don't know what it's called off the top of my head, but that like device has been very successful. I haven't really seen very many poor, outcomes or poor studies from it. Like, then I highly encourage people to get it because I don't think it's that expensive, and just to have that peace of mind, I think it's a good thing.
Just always like to ask our pediatric expert.
Now I'm the pediatric expert. I like it.
You are the pediatric expert. That's right. You are. All right. For the baby nurses that are listening, what's one piece of advice you give for surviving your first crashing airway? So each guest give one tip.
All right, Dom, you go first.
Always be prepared. You have to have your room stocked and ready.
Bam.
You never know.
That's
Working in an
it.
emergency room, even
That's
though I
it.
mostly served adult patients, I always had a pediatric and a neonatal mask at the bedside just in case that patient ended up coming to my room as overflow. You always have to be ready.
You kind of stole mine.
I
No,
know,
you got to
right?
come up. You got to
Actually, you
come up
stole
with your own.
mine. I
You
was
have
like,
to come
that's
up with
it.
your own.
That's it. That's it. That is it, everybody. Making
Yep.
sure that that room is prepared and that you're not running around trying to get stuff at the last minute. You hit it on the nose, Dom. That's definitely great advice.
Yeah, I
Thinking
used
two
to tell
steps
my
ahead.
Yeah,
Mhm.
team, I'm
preparation
like,
is key.
if you prepare for your patient to code, they'll never code.
That's true.
Ward
That's
up
true.
evil spirits. That's what they always
Yeah.
Hmm.
say, right?
But I also don't like the fact that I have walked in rooms in the past and there's not even a suction set up. That is not good. So you got to make sure that we, you know, be prepared somewhat,
And that's like
not
one of the
running around trying to get
easiest
stuff.
things that you can have. Like, to be able to open up and maintain a patent airway, probably one of the simplest techniques that you can do is having suction, because
That's
that
it.
will clog up your airways so quickly, and having suction to be able to, get it out of there is huge. So yeah, that's a pretty big stickler.
And I learned that from you, Brittany, when you teach pals.
Yeah,
Always with them babies.
always.
Suction with the
Hmm.
babies. Suction.
That's the biggest thing with kind of pediatrics too, is especially in that respiratory season, RSV, flu, all of those like viral things that kids get. One of the biggest problems is they create so much secretions. If you've seen a sick kid running around, they've got like snot and like everything. Just it's coming out of every orifice of them. I always say that. And the best thing that you can do for them is to suction them,
Suction.
because their secretions are so thick, they don't have kind of the ability to kind of clear it out. That's literally the number one thing that you can do for them, is to suction them by far.
Mhm.
Yeah, that's what our good friend Kara is dealing with right now with all of her kids.
Yes, our friend Kara was going to be part of our little, we call this like the FK bad group. And unfortunately, Kara was unable to make it tonight because she is a bonus mom to 5 kids, and she has got a sickness from her littles. So yeah.
Let's go.
But we want to make it clear we are the FK Bad Group, and we don't want you to think that's profanity that's being used. It stands for Felicia, Kara, Brittany, Anthony, and Dom. So it doesn't stand for anything that's bad. I mean,
I mean,
Even though
we're
bad
we're
is
bad.
bad.
bad, but we're not like using foul language. That's what I want to say. That's not the abbreviations for foul language. So that's
We will
very
see
important.
Kara back on here at some point. We'll have all 5 of us the next
Yes,
time.
We'll we'll
yes,
drag her in.
we will.
Yeah.
Yeah.
Yeah, so I feel like we kind of skipped this part a little bit here because we met Dom before. So Anthony, just kind of circling back just a little bit here.
Yeah.
Tell us about
Like
yourself.
Felicia said in your introduction, like we met you when you were an ICU educator. That's how actually all 5 of us have met, is we met as being educators together. So tell us a little bit about like your start in healthcare, your background, and where you are now, which we all know now is CRNA school. But
Get ready to put us to sleep.
Why? Because I'm boring?
No,
No, I'm just
put
kidding.
us to sleep because I'm gonna be getting surgery or something.
Oh yeah, that's why.
Yeah.
That's it. Yeah, there you go.
Mhm.
It is funny because we call Anthony the old man in our little
You do.
because he's
I
like
love
going to bed at
sleeping.
6 p.m. and
It's if I'm going to be passionate about something, it's sleep, which is now going to be my career.
That's
So
true.
it's perfect.
I love that though. I do. It's great. That's a great career. I'm
Yeah,
telling
I
you.
mean,
Putting them to sleep, long as you wake them up.
as long as you wake them up,
Yep.
that's the key. You got to be good at that part.
Yeah, you do.
yeah.
Yeah.
And keep them breathing.
Well, that's a bonus.
Yeah.
All right.
Tell us about yourself, Anthony.
Tell us.
All right. So I'm originally from Michigan. My career in healthcare kind of started, well, I don't know if I can do it backwards. This way, outside of Detroit. Actually started off, thought I was going to go into physical therapy and got my first bachelor's in that. And then while I was working on my bachelor's, I started doing medical scribing, ironically in the ER. And I
Wow.
actually loved the ER,
That's why we
which is
loved him, even though
crazy.
he's ICU. We still love him.
Anthony.
Yep. And like I really bonded with the nurses and like the physicians and the team in the ER. And with that job, I had the opportunity to kind of travel around the United States and go see different settings. So I got to see, ICUs, inpatient, outpatient, kind of everything. And then the nurses actually kind of talked me into going back to nursing school. So I applied to like all of the accelerated nursing programs, and at the time I was moving around a lot. So I just applied to all of them. Ended up going to Kentucky, got my nursing degree there. And then I started right off in the ICU because I knew I wanted to go ER or ICU. And unfortunately, at the time, there weren't a lot of ER jobs in that area. So I moved, got a job in a cardiac ICU, did that for a while. And then COVID came around.
Yeah.
And so, it was an interesting time, but it gave me the opportunity to do travel nursing and again, move around some more. And then I ended up here with this team. And I loved my team down here. And so I stuck around. I had fantastic managers, fantastic team. And then the educator role popped up, and here we are. I mean, I loved doing the education stuff, but I always knew that there was, like, I needed to do probably something more.
Right.
So then I shadowed around, and anesthesia is kind of like the
It is.
perfect gig. Because you get to deal with a little bit of the chaos while still being in like a controlled environment with, critically ill patients if that's what you want.
Absolutely. I
It's
love it.
kind of funny when you said that because it's like you're like, oh, I love that ER, and then you ended up in ICU, and I always thought the opposite that I was going to go to ICU, and then I ended up in the ER, and I'm like, you can't like it couldn't have been perfect. So that was a little funny. I like
That
that.
is.
That's something I didn't
I
know.
mean, the ER is like it's a really cool place, and you guys have talked about this. It takes a certain type of person, a certain type of energy to be in there. I think that like, the ICUs I worked in, the acuity was so high that kind of fed into that for
Yes.
me.
Yes.
So, I still got that part, the ECMO, the CRRT, those super sick patients. That was my, like, it's awful, but I still keep coming back.
Mm-hmm.
So then I never got down to the ER. I wanted to, never did.
Let's get that.
Hey,
But this was where
you
you were
did.
supposed to go.
Yeah, that's what I
Right?
was gonna say.
Not for everyone.
True.
Great path. So,
It's not.
Yeah. It's the path you were supposed to go.
what's like a
Okay.
wild, crazy ICU story though? Do you have a patient like you just have a wild, like crazy story?
Got a couple of those. I had a patient who there's two of them that really stick out. One of them, she had a cabbage procedure and then she had a reaction to the heparin. So she went into DIC and pretty severe. She ended up clotting off both of her legs and several of her fingers. And so she was on CRRT, the dialysis machine. And then, since she was too unstable to undergo any procedures, she unfortunately lost her legs, but she couldn't go to surgery. So we kept her legs in dry ice for several weeks, like big 2 foot long coolers with dry ice in them to preserve her legs until she could be stable enough to go to surgery.
Wow.
I mean, and she's survived. She survived this. I mean, and that's a very unfortunate
Wow.
outcome. But
How did you get dry ice? Like, that's
How
what
long
my
does
brain
it
is
stay
going
good
to right
for?
now. I'm like, "What? You got a cooler full of dry ice for 2 legs that are still attached to her?" Like,
yeah, I was changing the bed was a whole thing because, those things were heavy. But one night I had to go down to the loading dock, like, and just meet some strange man in the loading dock and get dry ice for my patient. And I thought, this is like the craziest thing. Like, why am I down here? It's 2 a.m. I'm meeting some strange man and he's just going to give me bags of dry ice.
Wow.
But yeah, they
Wow.
brought it to
rules
the
that are
hospital
made
and I
in
picked
the,
it up.
in healthcare right here. We're dealing in, bags of, dry ice and the loading docks at 2 AM.
Yeah, I remember
Wow.
talking to my charge nurse and she was like, you're going to go to the loading dock. There's going to be a sign on the wall. You're going to call the number. And I'm like,
Wow. I never knew
Never
that.
heard of
Oh
it.
my God. This was in the organization that we've all worked in?
no,
Okay.
no,
Okay.
this was prior to that.
Okay. Was just checking. Wow. That's pretty interesting.
Yeah. And the other one that really stands out to me was I had a patient, she was in heart failure. And she went into torsades, go into the room, start doing CPR, and she wakes up. And I'm like,
Oh,
whoa, because that catches you way off guard, right? You don't expect your patient to just open their eyes and start
no.
screaming. And so then I thought I did something wrong. And so the moment I stopped, she passes back out. I'm looking at the monitor. I'm like, this is real. I go back on the chest, start doing CPR. She wakes up again, and I'm like, what is going on? But yeah, they call it something. The name is past me now, but she really did. She arrested, and we ended up crashing her onto ECMO, which kind of sucked. But she was awake enough in between these episodes that she was able to call her husband and like tell him, "Hey, I just had CPR." And then she
What?
would pass out. We would do compressions on her, shock her. She'd come back. It was it was wild.
That's wilder than the ones that are talking to me with the ET tube in their mouth.
And I
Eyes
feel like,
wide open,
yeah,
having that conversation. Like, I mean, they're not vocally, you're not hearing it, but they know what you're saying and they're responding, and you're like, can we get this tube out her mouth?
yeah, they did that a lot in the ICU. You give them a whiteboard, and they have to write on
Yeah.
it,
It's
and you're
crazy.
like trying to decipher their chicken scratch, and you're like,
But it's nothing better than dry ice with legs in it and making a bed. That's different.
yep,
Wow. Dom,
five
I
or six
have to
people.
say this. I'm sorry, but you look naked. I'm
Thank you.
sorry. I
You're
keep
so
looking and
welcome.
I'm like, why does he look like he doesn't have a shirt on from this angle? But you do.
This is what
Okay.
you never know what you're gonna get here at,
I do have clothes on. This is a t-shirt. Thank you.
Okay. Okay. Very good. Thank you. I was
for
like,
those of you who are
I'm glad you
this
think that I'm
is
not as
not
pale as I
rated R,
normally am.
Dom. Okay.
for those just listening, Dom has a nude colored shirt on,
Hmm.
but he does have a shirt.
Yes. Just had to put it
That would
out
have
there.
been
It
something you
didn't
could
look,
have told
yeah.
me this morning when, when we started this podcast. Would have been great. But it's
Honestly, I
fine.
just looked and I'm like, does he have a shirt on? But you do.
Well, it's a podcast, right?
It is.
Do you need a shirt?
No, you don't. You can be naked if you like.
I
No.
mean, I don't have pants
But we
on,
would
but we
probably
didn't
not
discuss
put that
that.
on YouTube. We wouldn't put that on our YouTube
We're trying to
channel.
keep it PG though, but okay.
Hey, I put a shirt on, whether it's my skin color or not. You didn't tell me about pants though, so here we are.
You don't have to wear pants, Dom. No.
Yeah,
I'm not.
it's business from the, waist up. Party down south. All right, hey, hey, hey. Anyways, I think what Felicia was saying, it's time for us to switch gears a little bit, and this is the part of
And
the show where we drop our stethoscope.
yep, that means it doesn't have to be anything healthcare related. Okay? We just drop in the stethoscope. So, life outside the hospital. Because believe it or not, we actually do things that don't involve IV pumps and charting. Alrighty? So, let me tell you a story that I'm dealing with. When I dropped the stethoscope, actually had a CAT scan done last week. And it was pretty intense contrast. Just kind of putting it out there to you. I mean, I'm used to contrast and what it makes you feel like, but neither here nor there was no big deal. The next morning, I woke up and my bottom lip was boop swollen. I'm like, what's going on? Like Anthony's talking, whatever, whatever. And I'm like, wait. Something's going on with my lip. So I get some Centrazine. take that, take some Pepsid or whatever, going on about my day. You know, I still had my lip gloss on my lips, plumped up bottom lip and all. Alrighty, that night, go out, grab a bite to eat. Next day, top lip blows up. I can't figure out what's going on, why all of a sudden I'm starting to have these reactions. Still to this day, don't even know. I mean, it looked like I had fillers in my lips. You should have saw it. So, Centrazine again, also take some Pepsid. Didn't go down right away. Probably took a few days before that one went down. And then the next day I wake up and my whole body is rashed. I cannot figure out for the life of me what is going on. And I'm like, why all of a sudden am I like starting to have these allergic reactions to I don't know what? I thought it was possibly the contrast, you know, even though I'd never had that issue before, but the type of contrast they were doing is to prepare me for my radiation. So it's a different kind of contrast. And then the fact that I had shrimp the next night, and then the next night I had crab cakes. I'm like, I must have some shellfish allergy all of a sudden. And that's not good because I eat a lot of seafood. Well, I ended up in the emergency room, even though we're not talking healthcare. I really did. End up in the emergency room having to get the whole Solumet draw, Benadryl, Pepsid, concoction, even got an EpiPen now because I was rashed all over. Come home, no big deal. Now I'm like, I guess I can't eat any seafood. I eat some of my cotton candy. I've been hooked on cotton candy now for about a couple months, right? I eat some of my cotton candy. All of a sudden, red and rashed all over. I'm like, you gotta be kidding me. It can't be the cotton candy. I eat cotton candy every day. Never once did it cross my mind because they have the Halloweens out at your local Marshalls, TJ Maxx, and Home Goods, everybody. But don't buy them because I bought them all. And so I've been eating a lot of that cotton candy. Well, they ran out of them. And so they had this new kind called pistachio cotton candy. I didn't really want to try it, but I was like, let me taste it. And it was so good. It doesn't taste like pistachios, just so you know. That's the one that did it. The
Wait, for real?
pistachio cotton candy is the one that has given me a rash. So I had to throw away the pistachio cotton candy, and I was very
Well,
sad.
so you're allergic to pistachios.
And you know what, Anthony? I've never had pistachios, so I didn't know, right? So I'm like, something
Oh,
in it. I'm looking at the back of the thing, and it just tells you sugar and then yellow number, this number, red, this number, blue, this number. So I don't know what exactly is in it, but I immediately get a rash. Toss it, no big deal. Now it's time to bleach my hair. Bleached my hair last night. Spent some time looking at this girl on YouTube, whatever, whatever. And she was saying use extra virgin organic coconut oil in your hair with it. It makes it softer when you condition it. No big deal. Now, we all know Felicia doesn't sleep with anything on her head at night, but I had to put on a bonnet. So anyway, I put this on my head and like through the night, I'm like, something's not right. I'm really like itchy and stuff. I jump up, take a Benadryl and some Pepsid. The next morning, I am fully rash, meaning today, everybody, today, from face to feet, back, everywhere. I mean, it was bad, itching really, really bad. And I'm like, you gotta be shitting me. It's gotta be the coconut. I'm allergic to nuts, I think, all of a sudden, which is not a good thing. Everything has nuts in it. I'm like, this isn't cool. That's my story, and I'm not happy about it because now it's coconut and pistachios. Like, really?
Those of
Not
you
cool.
who can't see, me and Anthony, I think, had the exact same reaction, but both just sitting here like, what? Like,
Yeah,
we're
head
on
to
But
toe
can,
today. Head to
can we take a
toe,
step back?
head to toe.
Why is she eating cotton candy every day? I think that's a real problem here. Like
Why is that a
every
problem,
day,
Tom? Listen,
every day. I don't know what's in it, but I'm gonna eat it.
they
Like
come in these containers, right? And
well,
they
you want
come
this?
micro.
4
It's the microplastics.
different colors. This was green and white. I never once thought that I would have any issue with eating this cotton candy, and now I can't have it.
is it the
I'm
other
allergic.
cotton candy too? Have you tried the other cotton candy?
So I have been eating the other cotton
The
candy, never had
Bonobon.
an issue. So now I need to look at and compare the two because I
What
can't
dye
pick
is
one.
in that stuff that you had for your
I'm
hair
this
versus like
this is
Well,
wild.
that was that was extra virgin. It's just coconut oil.
Oh, there's stuff in it?
Coconut. It's like organic coconut oil. I mean,
Coconut's not a nut.
Yes, it is. Comes from a tree, the coconut
Yeah,
tree.
but I don't think it's like the same
you
type of
may not
nut.
be Anthony, but
It's
let
a
me just tell you this. Even the emergency room doctor was like, just from going through the chemo and stuff, my body's probably just reacting to stuff
To
that's
everything.
never been an issue for me. And I'm like, now scared to try almost anything. I mean, I have like red blotches. You can't really see it because makeup's on, but all over my skin. All over. It's so ridiculous. I was like, what can I eat and not have
Sir
to worry?
Clara didn't give you anything?
Huh?
You Sir Clara didn't give you anything?
I haven't seen Kara. She's gonna kill you. I haven't seen Kara at all. I did not get the whatever it is she got going on.
What did she get? What did she get, please?
I don't know. I just know I haven't seen her and I'm tired of all these rashes. I'm like, what am I supposed to do?
See, this is
Like
where
every
I'd be
time I
nervous
glance
I'm just getting
that
itchy by you
had
talking.
to meet the man at 2 a.m. to get the dry eyes. I'd be like, Felicia, I don't know what you're doing over there, but yeah, for real. My
Make,
goodness, I'm just
make
like,
sure
what? So it wasn't from the CT scan.
that your body just take it over.
yes. And I've not had any chemo treatment in 6 weeks. So my body's just doing its own thing right now. I'm like, what is going on? So all of a
Interesting.
sudden it's like stuff is just like ration up. Like I eat something and it's like, oh boy, I didn't even eat anything coconut. I put it in my hair and that was it. I could sort of start feeling the like itching and stuff. So I got up, took something, took it off, just kind of looked at my hair, whatever. And
But
then I
then
went
you
back to bed. But I woke up this morning and I had patches of rash all over me. All
then
over
you
me.
have so if okay, I'm getting more confused again because
Me too.
you 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 had a localized coconut, right? But then you still got a full systemic
Systemic
rash?
rash.
Yes. Because but think about it. It's it's that coconut oil. So I mixed it with the conditioner and put it in my hair. It can get it. You guys saw me with the black hair dye. Come on, stop it. The black hair dye and the whole bad allergic reaction. Don't take it gets into your body systemically. Your pores open up your scalp
Mm,
and everything.
your
So
body
it's in the
absorbs it.
bloodstream.
Mhm.
Yeah. And that's what happened. And it was just terrible. Again. So
Also have to
Don't
go
dye
back
your
to the
hair.
fact, though, that you threw away a ton of good pistachio cotton candy that someone else could have enjoyed. So
oh no, I only had one
No
more,
one else.
Brittany. Oh no, 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 no. But I have 6 of the other ones back in the apartment in New York. And I gotta try it before I have to sit there and get rid of them. Like, I've never had a problem. Those are the Halloween ones. So those are the pink and the blue and purple. But this was only green and white. I don't know if it's I don't know what it was, but immediately I started rashing up. And I was eating that every night when I was thinking it was the contrast or that it was shrimp or that it was crab cake. I was steady eating that. So I wasn't putting 2 and 2 together. I was like, oh, I got a shrimp or I got a shellfish allergy now. That's what I thought it was, not the cotton candy.
this is just all wild. I don't even know. Like I don't even know what to
Crazy.
say to this.
Imagine
Yeah.
telling the ER doctor the story. So, you know.
Huh. Well, okay. On a side note, what is going on with your journey right now? Like, where are you at?
So my journey as of this time, so we all know I'm home in Tampa right now, but I will be going back to New York on Sunday. On Monday, I will be starting my radiation treatment along with what they call a PARP inhibitor. That's a chemotherapy drug that's very similar to the Fulfanox chemo medication that I was receiving biweekly. So I can still get some of the symptoms that I had, but they should be nowhere near like what I was dealing with when I go through the actual full treatment. So this will be 5 days a week for an entire month. So Monday through Friday, they say it's no more than 30 minutes, which tells me it's probably pretty intense. And if you all recall from a previous episode, I was telling you they put a fiducial down, which is like a little metal bead. Mine's are gold, and they put it up there and they tattoo it to the tumor, and that way they can target the tumor. And if I had to come back here and have radiation for a reason, they can target it. That way it prevents them from, messing with any of my other organs, like my liver, gallbladder, whatever, like that. So that is the plan. Starting October 6th, goes through to November 7th. And then I will be back in Tampa because I can't afford New York.
Nobody can.
No, it is, you know, girlfriend living bougie though. Like, I'm living in an 800 square foot apartment and it costs a pretty penny. But we live like in a nice area where there's a TJ Maxx that sells Gucci across from me. Like, what are you doing with Gucci in there? I'm coming to buy cotton candy. They had Gucci. I flipped those shoes over and I flipped them right back over and said, I don't belong in here. It's $1,500. I was like,
TJ Maxx.
Manhattan's TJ Maxx. That's on another level, Anthony. That is not like the rest of the TJ Maxx. It's Manhattan TJ Maxx. And I'm beside it's right beside a Trader Joe's. That I've never seen all the action that go on in there either. Like, I've never seen so many people in a Trader Joe's that somebody's standing up on a ladder directing. They got 35 registers open and directing you where to go. That's just how busy and crazy this Trader Joe's is. Is that how they usually are? Because I don't go to the one in South, where we live.
Oh
Like,
no, the one in South Tampa is always busy.
this
Like
is
there's a
crazy.
line
I'm
of
like,
cars waiting to get in.
it's crazy. And I don't know if you all know, in New York, you have to pay for your bags. That was something that I didn't know anything about. And when you go into these stores, now I see why everybody already have a bag on their shoulder, because you have to pay for bags. We're really spoiled here. We just don't even know it. I'm like,
And then
oh
you
my
gotta
God.
Podcast
carry it.
season.
You gotta carry everything.
You have to
Yeah.
carry everything. These people walk a mile a minute, but I love that they mind their own business. Okay?
Mhm.
You have toilet paper hanging out your butt. Nobody cares. Everybody is minding their own business, walking their dogs, and they're not in your business. Okay? And I absolutely love that. Unlike some other places, people are all up in your business. So I do like that about it. Everything is moving fast. Everybody has a place to go. And they're gonna get there, okay? Everybody jaywalks. There is no pushing the button and waiting patiently. Nobody's got time for that. I've mastered that thing. I'm like a New Yorker already. For real. I'm like, let's go, Anthony. Let's go. Walk across. Come on. We can go. The light's red. We're not gonna wait for it to show us the walk. Let's go. And that's how it is. So,
Podcast season 2, we're all gonna do it in New York, all in one room
my
together.
God, I would love that. I really want to make it a trip once a year. I do. I need it because I really am enjoying myself. I just can't live there because the traffic is ridiculous. Like, they charge a congestion fee.
Yeah, you can't be driving around.
Yeah, you can't be driving around, and if you are, you better keep your eyes on the road, okay? Because while you sitting there waiting to turn, the car behind you then came around and went on past you. Like, they don't have time for the bull crap. If you can't drive, don't do it. Like, seriously. I'm like, this is crazy. So that's kind of where my journey is at this point. And I'm looking forward to that 1 month, starting it and getting it done and coming back here and us having, and hear me now, everybody, we're going to have a big shindig, okay? That thing is going to be huge. It's going to be in a venue. We're going to be dressed down to the nines, okay? Like, seriously. And I expect everybody to be there because that's going to be the celebration from everything that we've gone through here. That's the plan. So get ready. Just
You've been
putting it out
warned.
there
We'll be
now.
there.
You've been
Okay.
warned.
Mm-hmm.
Aw. Good.
I know, I'm
I'm
excited.
glad. I'm glad that things are working out, continuing
They
to follow
are.
your journey. Anything from you, Dom or Anthony? What's going on outside of work life, hospital life for you guys?
For me, just working on myself. So I'm on a health journey right now, trying to lose some weight. So I started the trizepatide shots. I am actually down 45 pounds.
That's awesome.
Congratulations.
Thank you. I have dropped quite a few sizes as far as pants and shirts go. I'm walking around work and I got basically put on notice to get some new scrubs or I'm going to be in trouble for dress code. So I did order them. They're on the way and I've been wearing a belt to work. So the journey's been great. But aside from just losing the weight, I've actually been able to stop my blood pressure medication, which has been my biggest feat right now. So just kind of
That's
working on
awesome.
myself, dropping some weight and yeah,
Yay.
feeling
I
great
love
about it.
that. Love
Hey,
that.
that's
Amazing.
awesome.
Yay. I can see it in your face. I've been meaning to tell you
Okay.
that. It's slimmer. Absolutely. Don't you feel great?
Yeah, no, I feel so much lighter. The fact that I know my heart's not pumping as hard, like it's easier to get up and down stairs, like just have that weight off your bones and everything too. It's just easier to get around. You have more energy and more willing to go and do things.
That is awesome. I'm so proud of you.
Yeah,
Seriously.
Yeah, that's
congratulations.
amazing.
Yay. And Anthony,
Uh, school.
I need you to sound happier,
He's
Anthony.
like, you know, well,
No, it's been fine. It's really that transitioning from, kind of working and just doing my thing to now being a student again and kind of being on someone else's schedule has been kind of a culture shock. But I mean, I feel like the last couple months I've kind of been able to like go out and do things. So like we went to Toronto, did a couple trips here and there, but unfortunately it's the nature of the beast until I'm done.
You
longer.
celebrated your birthday yesterday. Happy birthday,
Yes, I
Anthony.
did.
Happy
What
Thank
did
birthday.
you
you.
do?
We just did like a brunch and then watched the football games. Nothing too
Good.
exciting. Yeah.
Keeping it simple.
Yeah. I mean, it's hard because I can't go out.
I
Like,
know. Gotta stay. You know
so
what? We knew this focus was gonna be, this is the way that it was gonna be, and it'll be over before you know it.
I
You'll be
know it's
putting us to
hard.
sleep surgery. So,
I've
hey,
already been gone over a year.
I know. Trust me, I know. I know.
Abandoned
Yep.
us for over a year now.
Yep.
Over a
Well,
year,
you
almost a year and a
abandoned
half.
us too, somewhat, Dom, and it's
I
just
am still
hard.
in the organization.
I mean,
I
you
am
are,
closer than
but
Anthony.
you're dealing
I'm
with other drama.
technically still in the organization.
Yes, you are, Anthony.
Technically and
You are, and
legally.
Glenda is too. I love it.
So wait, how much longer, Anthony?
I don't graduate until May of 2027. So year and a half
That's
from
really
now.
not
Live's like almost over, so
No, I mean, really, once January hits, it's mostly just clinical. So,
nice.
so a lot
Nice.
of the classwork's behind me. You just have to work on my DMP project and go to clinical.
Do you
Work
know
for
what you're gonna
free.
LTC.
do
What do you mean? Do
for
for
your
what?
DMP project? You say your project.
Yeah, we're basically trying to improve communication around like local anesthetic toxicity
Okay.
at one of the facilities in town. So they haven't had any events, but it's just to like standardize their handoff.
Got it.
And
Hey,
then
I got your project done for you. I just put it in Chat GPT. So hey, we have a whole week we can burn now.
God,
I mean, that's
I
a whole,
love
yeah,
it.
I got a year of my life back. That's great.
There you go, Anthony. You can come hang out with us now. What
I mean,
about
it's
you,
really,
Brittany?
oh my gosh. I've got a lot of things in the works. I can't just can't stop. But no, obviously this has been a good focus of mine. I also have MedMax EDU coming out with my EKG workbook soon. So
Good.
struggle with
Mm.
EKGs.
Oh, baby.
This will be a great little tool for you to be able to kind of break down the rhythms and try to understand them a lot more. Also going to be doing some more pediatric type of education through there. There's a new emergency nursing like advanced triage course, so I'll be hopefully attending that and going through that soon. So lots of new and fun and exciting things with MedMax EDU. And then also like Dom, I'm on my own health journey and I actually from work went to Pilates today and then came back, showered
Ooh.
and quickly got in here and my legs are on fire. So if I'm walking abnormal tomorrow to anybody that sees me, that's why. So
Looking good as she does it.
so yeah, that's just my life. It's just busyness, but in a good way. So
I'm so proud of you all. Each and every one of you. This is great. This is so motivating. I really am.
coming from you. Yeah.
Yeah, you're the most.
My motivation stems though from you all. I honestly, because sometimes I've had my days of circling the drain and I'm like, girl, get it together. Cause look at these people. They're like, you're doing X, Y, Z. I mean, honestly, it's because of you all. Cause it's not easy. I'm all I can think about is, like I want my life back. Like I need my life back where it's not always a focus on some type of diagnostic testing or getting some type of treatment. I just am ready for that to like be in the past and moving forward because I got a lot of life to live. There's so much that I want to do, but I will tell you, this journey has taught me such a lesson that things that you can change, just do it. Don't stress about them. I know we get upset and it's easy for to say, don't stress about it, but you can change it. There are things, I hate to say it, like what I'm going through, it's not something that I can just up and change. I have to wait the process. So it has taught me a valuable lesson to not stress about the things that could be changed. Maybe people don't want to change them, i.e., file cabinet. They don't know that story, but it's just it is something that can be
You want to tell me?
changed, and I don't need to stress about that. I don't need to stress about that at all. Like they're gonna do whatever it is they feel they need to do. And if it meant emptying out my file cabinet and giving it to someone else, so be it. Maybe I won't need that file cabinet. That's how I have to look at it, you
At
know?
least you have an office.
Like, see, I do. Like, I have to. I'm like, well, didn't matter that they put my stuff in a box and put it above my desk. Doesn't matter. Well, I'm not gonna worry about it, you know? That's my advice to everybody else. Something that
Live your best
there's
life
just
outside of
things you
work.
don't need to worry about. And that's one of them that I don't need to worry about. There's a reason for everything that happens. You just don't always know what it is, what the reason is, but eventually you figure it out. You find out. So that's how I see it. This journey has taught me a lot, a lot.
Well, that is coming to the end of our time together tonight,
Yeah.
which makes me sad in a way because I feel like we could all just
Too.
continue to talk to each other forever about lots of things. It's our little group get-togethers.
I do
We haven't
too.
had one in a little bit. We came together for my birthday, but it's been a little bit, so it's nice to kind of catch up with everybody. And the next time you,
We need a day this week while I'm home.
Yeah, Anthony should have scheduled that, being his birthday yesterday, like Brittany scheduled hers, we would have been there.
yeah,
Well,
you
he
have to take
got a
that into
You
point.
know I don't plan things well.
You do, Anthony.
Alicia,
You
pick
know,
a
Dom,
day.
you're the planner.
Yeah, I need motivation. I can get us there, but you guys got to start it.
I'm like that. Dom, you're the planner.
anyways, we will be back with our
Yeah.
FK bag group together
Yeah.
with Kara
Minus
in
Kara.
there at some point for a future episode. But I love our little crew, love talking to them. And just to kind of end
That's
our
right.
show, thank you everybody that's been
Yes.
tuning in,
Thank you.
listening on Apple, Spotify, on the podcast, watching on our YouTube
YouTube.
channel, following us on socials. We thank
Yes.
you so much for the love and support. Please don't forget to like, share, subscribe, keep up with us on our social media accounts. We're just really grateful for, any love and support that we're getting. And we're hoping this
Absolutely.
podcast is giving you a little distraction and a little fun from the chaos that is healthcare for sure.
For sure.
So until
And I'm
next
not naked.
time,
No, you're not, Dom. Thank you.
my gosh. Until
Next
next
time you
time,
will be.
everyone, hold my stethoscope. We'll see
Hold
you
my
all next week.
stethoscope.
Bye,
Ooh.
guys.
Bye, guys.